Give me just a sec here. Sorry, guys. I want to get plugged in.
How prepared you are.
What is this, Casey?
Yeah.
Look at that.
I think we're close enough. It's gonna be fine. Okay. All right. So this is like an introductory needle stick. We're gonna be doing upper trapezius. All right. So like we talked about, clean hands, gloves on. If there's clothes in the way, get it out of your way. If you need towels or sheets for draping, you can drape up. But this is still just practice for the mechanics of the needling. Because as you guys noticed, the first time or two you do it, it's a little bit like, wait, what? Psychomotor wise, like what's going on? I'm gonna kneel so you guys can see. Maybe can that shoulder be there? I'm just gonna go ahead and get this out of our way. Is that okay there? Okay, we don't have to do that, but I'm gonna do it for this. Okay, we've got a nice upper traps bulk here, right? And the cool thing about the pinch technique is that if I pinch here, I know there's no lungs between my fingers, right? And so with the pinch technique, I'm gonna pinch it here, put my needle next to my thumb, and my needle can go, either it can go towards my fingers, okay? Or I can open up my fingers on the back end, and my needle can go in between where my fingers are if you're worried about sticking yourself. That's really hard to do though. The skin on the other side is so thick, so tough. What you'll do is you'll needle towards your fingers and you'll feel the needle on the other side of the skin knocking on the door. And unless you shove that needle hard and fast, it will not penetrate the skin on the other side, just so you guys know. I would love for you to be precise enough that you can do that you can do a pinch technique, you can feel the needle, butt up against the skin, up against your fingers, tap it and say hello. It's not gonna just poke through all of a sudden. But if you'd rather err on the side of caution, you can keep your fingers apart and the needle is going there. So if it does happen to poke through, it's not poking your finger. Yes?
Hypothetically, if it did poke your finger.
If it did poke your finger, then pull it out and you follow like infection control, which is to wash your hands, and I guess you can report to a doctor and ask your patient, do you have any bloodborne like pathogens that you know of or anything like that? So therapists do stick themselves sometimes, and I have not heard personally of any problems or issues or anything like that, but err on the side of caution. You will feel that needle a long time before it pokes through to say hello. If you'd rather needle with your fingers apart, you can. At some point today, go slow. At some point today and tomorrow, I want you guys to all feel that. Even if I'm the one like doing it, I want y'all to all feel that. So pinch technique. So we can do this. I can needle towards my fingers, in between my fingers, or I can just say, you know what? I know there's no lungs that way, so I can angle my needle kind of that way, right? So we can alcohol wipe the area. This is just for practice, so we're not going to talk a lot about complicated stuff. We'll do that after lunch. So there's my pinch, right? Like that or like that, whatever you prefer, right? You can play with it, depends on what angle you're coming from, okay? Now, this is green light, that's red light, right? So needle towards your thumb. There are no lungs between this finger and that finger, so I'm gonna needle towards my thumb. I need to slow that down a little bit, right? Drop the needle onto the skin. I'm holding the tube with my bracketing fingers. I'm gonna remove the needle. It might fall a little bit. It's not going anywhere, okay? Take the needle, try to move it forward slowly. Uh-oh, it doesn't wanna go. I'm gonna grab the shaft and I'm just gonna give it a quick little, there we go. And now we can progress. Okay, and I can feel that needle.
Oh. She can
That's
feel
spicy.
it too.
And then I'm gonna stay firm, not gonna freak out, and I'm gonna go ahead and pull it out. So you can stay firm for like a second, don't be frantic, and then pull it out. Even if the patient's like, ow, ow, be like, okay, I'll take it out, right? And then, so, did you guys all get the mechanics of, I'm not gonna do it, I just wanna show you. Did you guys all get the mechanics of holding the tube with your first and third, and then we've got this finger right here, that's our tapper, right? If you guys need to practice that on like the mat, on some fruit or something like that, you can. But they gave us a banana at Connecticut, right? So we could have done that, but we didn't. So tap it hard and fast. Cool? Okay? Yep. So let's practice upper trapezius, and then we'll take a break for lunch, and then we'll have some fun.